you so much, Mr. Chairman. I'm very happy to be the ranking member on this committee, and I'm looking forward to working with you and all of our colleagues on both sides of the aisle to advance strong bipartisan solutions to the issues we face. And I, of course, join you in saying we need to be safe from dangerous drugs like fentanyl. I do regrettably have to correct the record already, even though it's just my first opening statement. Under the Biden administration was also working hard to curb fentanyl, and that's why last year the deaths from fentanyl were below 90,000, which was a decrease from 128,000 just the year before. So I hope we can continue this, but I think demagoguing on the Biden administration's success and saying that deaths were higher is inaccurate. Something else I want to talk about is the developments that we've seen in the last couple of weeks under the new Trump administration. Donald Trump kicked off his term with actions that led to a day-long freeze of Medicaid funds for every one of our states. Last Monday, Denver Health, which is our safety net hospital that serves a regional area in the Rocky Mountains, called saying all of their Medicaid funds had been frozen and they couldn't provide medical services to thousands of people. Now, in response to Donald Trump's executive orders then, CDC removed from its website that guidance that doctors rely on to treat patients every day and data researchers use to improve public health. I got a call from my daughter. Some of you guys know my daughter, Rafaela. She's an internal medicine doctor at UCSF in San Francisco. She told me that they couldn't get the CDC guidance on birth control or on vaccines. And as of 2 days ago, they still couldn't get the guidance on birth control. And of course, there's no available guidance for healthcare for LGBTQ individuals anywhere. Also, NIH grant making for critical biomedical research is at a dead stop with no end in sight. I got calls from some researchers at Anschutz Medical Center, which does important life-saving research, and they were unable to access their grant dollars for some time last week. And now, a 23-year-old SpaceX intern has been given access to systems containing sensitive information about Medicare and Medicaid. Mr. Chairman, I was just saying to you, my constituents are terrified about what Elon Musk and his lawless Doge are going to do with that access. I had over 500 phone calls in my office in the last 2 days, many of the individuals who were sobbing. So as Donald Trump ground NIH to a halt and disrupted funding for safety net health care, where is the outrage from the other side? I have only heard Democrats speaking up. Are all of you afraid of Donald Trump? Do you agree with this lawless assault on science? The Constitution obliges the President to faithfully execute the laws that Congress creates. And Article 1 of the Constitution gives Congress that authority. So why aren't we exerting it? The founders envisioned the checks and balances in our Constitution as necessary to curb abuses in the government. Quote, ambition must be made to counteract ambition. That's from James Madison. And the government must be obliged to control itself. We need to assert Congress's authority. It's shameful that Republicans have sat by while Congress, the first branch of government and the voice of the people, has been silenced in this diminished state and allowed the executive branch and somebody who's not even elected or appointed to office to ignore the law. So let me assure you, our constituents are watching what's happening. They are not happy. And amidst this lawlessness, this dangerous agenda to take health care away from hardworking Americans is not going to go. We are going to fight with every fiber of our being to make sure that that happens. So that's pretty much how I'm feeling this morning. And I'm going to tell you, if you try to cut $2 trillion to Medicaid in order to pay for tax cuts for the wealthiest in this country, this is not going to fly. We need to have quality health care for every American. We need to have biomedical research that will find cures for the diseases that we all care about. And we need to continue to have adequate and full information so that everybody can get the quality health care that they need. So I guess I look forward to working with you. It's going to be a long 2 years. I yield back.